Answer Tamer. I'm your host, Dr. Charley Ferrer.
And hi, I'm Debra Santulli-Barone.
And today we have a show that was requested by you. And talking about what?
Okay. Dumping your doctors?
Breaking up is
hard to
do. And so what we want to talk about today is how to deal with doctors and how to decide which doctor is most appropriate for you and which isn't, and when to change.
That makes sense. Yes, because a lot of you feel that you don't have a choice or you don't have the power to advocate for yourself, but you do. You do not have to stay with any doctor that you don't care for. That's all there is to it. And it's quite simple. You don't even have to tell him to his face or her to her face. You could just call up the office and say, I'm canceling. I'm changing doctors. Please, direct all my files to the next place.
Right. And it is that piece of remembering that you have the right to choose your care. You as a patient, whatever insurance you're in, or if you don't have insurance, if you're on public assistance, whatever, you have the right to choose the doctor that is treating you. And if the doctor you are working with does not feel right, does not have the correct energy for you, is condescending or inappropriate, which sometimes they are, it is okay for you to say, hey, I need another doctor. It is okay for you to change practice and hospitals. I was originally going to Staten Island University Hospital. I did not care for the doctors there, and I moved my care to Mount Sinai, which I ended up enjoying. And Debra goes to...
I go to Weill Cornell, New York Presbyterian.
Right.
But again, I went for three different, I went to three different doctors to just make sure that they would all concur. Because it's always good to get other ideas. That's very important to do that. And that's, I don't know how many doctors you went to, but I know with me, that's what I did.
I had quite a few doctors.
Yes.
And because of all the complications that I had, especially with the sweet syndrome that I developed, it became one of those pieces of lots of doctors wanted to see what the changes were happening and the scarring and so on my breast. And so it became, I was the medical phenomena of the 2 years at Mount Sinai, because all doctors from all over the country and all over the world were wanting to see what sweet syndrome looked like in a patient.
Let's talk about that, because some people might have missed the last show to talk about what is sweet syndrome.
Okay, so sweet syndrome, and we did a whole show. Dr. Jacob Levitt was one of our guests a couple of years back that talked about what sweet syndrome is, and sweets like in candy. Sweet syndrome is an immune disorder, and the sad thing is that most doctors do not know about it. And so what happens is that your body has trauma, and so in my case, the surgery of the dual mastectomies was such a trauma to my system that my body actually went into hyperdrive, what I call hyperdrive, and my white blood cell count went sky high. And so everything and anything that was done was seen as infectious. So even the stitches were, my stitches dehisced because my immune system was fighting them. And so I
like
ended
an enemy.
up...
It's an enemy,
and
right?
so what it did was that, it tore all my flesh. And so instead of the skin staying together, it was actually open. So I got to live a horror show. Saw the insides of my body, did not appreciate it. I'm not that kind of doctor. But the whole point was that the doctor that I was seeing and my surgeon at the time wasn't aware of what was going on and was inappropriate in the fact that his idea of treatment was, well, we'll see what happens. 3 months later, I'm into my second surgery. We'll see what happens. And he already wanted to go into a third surgery. And at that point, it was like, no, you're not treating me, and you're off into Indonesia for vacation with your family. What the hell is going on? So it is so important for you to advocate for yourself. And if you don't feel comfortable, change that doctor. Go for the referral,
right.
And be able to remember that it is your right to do that. That also includes if the doctor is talking to you inappropriately. So we have to admit sometimes, you know, the physicians are so apathetic that they don't realize how they're coming across and their bedside manner or the information that they're giving to you. They're so used to just telling you, here you go, this is the treatment, keep going.
Right.
And they don't stop and talk to you. They don't stop to explain things to you. Or worse off, that they use guilt and shame against you.
Did that happen to you?
Yes, it did.
Okay.
And not only to me, but I also talked to quite a few women that had told me the experiences that went through when they decided whether they didn't want a certain treatment or they didn't want the medication or they didn't want something that their doctor was recommending. And it went anywhere from, you know, if you don't want to take your medicine, then go home, look at your daughters, and decide when you want them to bury you, which was one of the comments. The other one was, well, you know, I've been doing this for 20 years. Do you think you know more than me? I actually, one of my doctors, which is no longer remained my doctor after her comment, was when I said, you know, I've been suffering from migraines for quite a while, 6 months, in fact. What she told me was, well, you have a brain tumor because you refuse to take medication. And I was really upset with that one because she had not done any kind of test, hadn't seen me in over 6 months, and all of a sudden I had a brain tumor because I didn't want to take a Rumidex that was destroying my body. So again, inappropriateness.
Right. And that you're questioning the doctor, and some doctors can't handle that. That's what I blows my mind. I think a secure doctor that knows what he or she is doing can be open enough to listen to what you have to say, open to suggestions, and not just say, hey, you don't know what's going on. I'm the doctor.
Right.
You know?
And understanding that sometimes your desire for treatment is not the Western medicine. Mm-hmm. You know, some of us follow more holistic path. Some of us want a combination of holistic and traditional medicine, and being able to find a physician that is in part, you know, on your side. It's on your bandwagon because that's who's living this, not them. Mm-hmm. So if you find that you do not have one that is treating you with the respect that you deserve, then it's okay for you to decide to go somewhere else. I have to say, you know, I've been doing this for 5 years now. February makes 5.
Right.
And so my thing was, out of that 40 doctors that I had seen for the various conditions, only 2 I loved. And one I only saw one time.
Really?
But this one doctor, and this was after my thyroid surgery, a year after my thyroid surgery, she was the only one that when I walked into her office, she sat down and she goes, okay, Charley, these are the things that you need to know. And this is what's going on in your chart. And this is what your levels were. And this is why this is important. And she just kept going and going. And I'm just sitting there stunned because it was the first time that a physician actually sat down with me and explained it to me in terms that I could understand.
Right.
And explaining to me everything. And all I could do was look at her and go, can I give you a hug? And I'm like,
oh, that's beautiful,
I'm almost crying in her lap.
Right.
I was so floored that after 2-3 years of dealing with different doctors and just constantly asking for information, you know, that somebody actually just gave it to me.
Right, and she respected you too. I think she showed you a lot of respect.
There was a
which
lot
is hard
of it
to find. Yeah, because that's very hard to find,
right.
even to get
and
respect.
I have to say, she was a youngin. You know, she was just starting out. She'd only been in practice for about 1 or 2 years. Not jaded, I would say. But it was just that piece of her taking me in as part of my own treatment. So letting me be that advocate for myself that I'm adamant about being, and you know, listening to my worries, my insecurities, my comments, you know. So finding a doctor like that is precious.
Yeah.
And being
would think.
able to request that is your right.
Yeah, it's hard to find too. On top
Yeah.
of all that,
Yeah,
That's
and I have to
definitely-
say, I give a big shout out to Dr. Jacob Levitt from
Yeah,
Mount
he's
Sinai.
great.
I
We
just
love him.
that man. And my joke was that here was a doctor that stabbed me, probed me, constantly. And what I mean stab is he was
Doing the
constantly for
cortisone.
2 years doing cortisone injections and to heal my breast. So he actually saved what was left of my breast. And so our big joke was that, we had this relationship where he was constantly doing these things to me. But he was just so wonderful. And he was just like right on the money. He's like, when I got my thyroid cancer, I was like, well, do you think that I should get this? And he goes, don't be stupid.
Just like
if the
that.
doctor says you need to get your thyroid gone, then you just shut up and do it. And I'm like, okay.
But by that point, you really trusted him, and that's the
Yes.
good feeling. If you can actually trust a doctor, not only because of the credentials, I'm saying, but you trust them because they really have your back. I think that's great. That's hard to find,
Yes.
sometimes.
Yes. And not all doctors are inappropriate.
Right.
So I have to say that. Not all doctors are inappropriate. There's wonderful, wonderful doctors out there. You just have to find them. It's like anything else. We talked about the shoes analogy before. Not every shoe fits. And some shoes are wonderful and they look beautiful, but they're to the door shoes. You put them on, you walk to your door, you get them off. Because they're just
They
not,
hurt.
they hurt and they're not comfortable. So make sure that for you become your advocate and talk to your doctors, shop around. You shop around for bargains for your clothes and your groceries. Shop around for your doctors as well. And that's your right. You do have the consultations, and sometimes it's having more than one doctor playing together.
Yes.
There are different. Suddenly breast cancer is all the rave right now, so everybody's opening up clinics that specialize in breast cancer, and so being able to decide which organization you want to go through. Do you want to go to this breast cancer, organization, or that one, or this one, or whatever, and being able to decide, and being able to know that you can jump through.
Yeah, definitely.
We have a friend who her doctor actually, when she had a horrible tumor, and her doctor missed it and misdiagnosed it, and you know who I'm talking about. And the one thing that I thought was so inappropriate was the doctor told her that she had missed the tumor because the tumor was hiding.
That's what they
we
said.
have a big golf ball tumor. How the hell does a golf ball tumor hide?
Oh, how odd.
But that was her excuse
Right.
for inappropriateness.
missing it, yeah.
So again, always check and see, and it's up to you how much advocacy you want to do. I believe that if I'm a nuisance, not that I ever am, and I don't want to use that word nuisance, but
Some doctors see it as
but
that,
some
yeah.
doctors see it that way, and it's
definitely.
okay, fine. That's the way you see it, then you're the wrong doctor for me.
Right.
I need to
That's
go to
true.
somebody else. Same thing, and I would recommend getting yourself a therapist. Especially going through breast cancer, thyroid cancer, leukemia, any kind of chronic illness. You need to have that support. I tell you what, your loved one is your loved one. They should never be your therapist.
Oh, because they're not into what they don't step into your shoes. They can be loving and caring, but it just doesn't work any other way. So, yeah, and be advised that a lot of the insurance companies will pay for it when you have cancer. Actually, at the cancer hospital that I go to, the therapy, my coverage covered it. But they even have the therapists.
Social workers.
Yeah, social workers. Yeah. It's very important. And another thing I wanted to say was that, you read about all these cancer centers in different states that only deal with cancer. They're not any other kind of hospital. And I went to one of them in a different state, and they couldn't come up with a better protocol or treatment than my own doctor was doing. So the big hype and what they charged my insurance company when I found out later on, I couldn't believe it. And I said, but they didn't tell me anything new,
Yeah. And sometimes you don't need anything new.
Yeah.
Sometimes it's just the reaffirming of the information, just to know that, hey, thank you for reaffirming what my doctor said. Okay, that makes sense to me, or it doesn't make sense to me, or I want to follow the protocol, I don't want to follow. It's all up to you. And it is, Terry, who actually was on the play, she made a wonderful point that some of us want to know, some of us don't.
Right.
Some of us want to be advocates, some of us don't. Some of us want to follow quietly, some of us don't. Wherever you fall on that continuum is okay.
Right.
It's up to you. It's, if today you want to be a kick-ass advocate for yourself, great. Tomorrow you just want to be quiet and sit there and just go along, great. There's no right or wrong.
Right. You just choose what you want.
It's just you.
Yeah,
exactly.
That makes sense. That's a good way of putting it. I think that's very important. Yeah, because I think I've met a lot of people that have said they didn't even know the name of their medication. And for someone like me that reads about everything and wants to know exactly what I'm taking and reads the 8 pages of side effects and then questions everything, but everyone's different. Some people can handle it, some people can't. It's scary, but I'd rather be scared but know than be scared and not know, because that's even more frightening for me.
And my thing is, I hate to react out of fear. I want to know what to do if the car is coming at me and is going to hit me. I want to know that I can move out of the way.
Right.
Teach me that I can move out of the way. I can jump. I can wait for the red light. I can, there's so many different things that I can do instead of just stand there and wait for the car to hit me.
Right. Have options.
So knowing your options, knowing the things you can do, being prepared, being informed. For me, that is the way to keep me calm. You keep me in the dark, I start freaking out. So just know your level of awareness, what you want to know. And it's okay if, things get crazy. That is why, again, I recommend getting a therapist, especially one that understands breast cancer or any kind of cancer.
Yeah, definitely.
When you're dealing with cancer, it's slightly different than dealing with with other issues. Especially, it's also very different than dealing with addiction. So you want to find a counselor that's able to talk to you on the level and on the discussions that you need. And so the beauty of it is that, I mentioned before, you don't want your loved one to be your therapist. And the reason you don't is because, one, they're not qualified to be your therapist, and they may be going through issues of their own.
Oh, yeah.
They're freaking out because their loved one has cancer. And, when you start thinking of, well, oh my God, I'm going to die. I need to talk about death. I need to talk about putting my funeral arrangements together and putting my papers together. They start freaking out because they think that you're thinking suicide, or they think, oh my God, my loved one is going to die. And so now they're in crisis mode and they don't want to hear it.
Right.
And so instead of you trying to placate them by keeping your fears inside, make sure that you find that therapist that can talk to you and you can unwind and do the crazy with them.
Right, that's true.
Because that's what therapists are for. I mean, it's like you don't want to do all the crazy with your loved one, but you want somebody there that's just going to be there for you. They have no skin in the game, so they're not going to go, oh, well, wait a minute, you're not listening. They're just going to let you vent.
Right.
And
it's
sometimes
all about
that's all you need.
Yeah, definitely. And most places that you go, your breast oncologist can advise you in the building, maybe that the doctor is in, or surgeon, anyone really. I found it in the hospital where I go for all my test result, to get my tests done.
Yeah, and now many of the doctors or many of the hospitals are now starting to open up to more holistic treatments. They're taking in meditation, they're taking in yoga, they're taking in, or they're offering, I should say, not taking in, but they're allowing all of these Western and Eastern philosophies to come in, what used to be known as the hokey New Age movement.
Right.
But it's not. It's just that you are connecting body and soul, and whatever that means for you. That's important. So being able to open yourself up to that. So if yoga works, awesome. If meditation works, awesome. If, doing spirituality and sound treatment and so on, these are all ways of being able to deal with mental health. And dealing with mental health is so important.
Yeah, when you're a cancer patient, that's very important.
Yes.
And it's also good to try different things. Now, we're talking about COVID again and being home alone or whatever. I just found out about a course online for Reiki, and it's called Beacons of Change. So I'm going to check it out. And actually, they were very nice because I really couldn't afford what they were offering. So I said, listen, I'm a cancer patient, and I've had this and different cancers. You have to do better. And they were really nice. They, had an open mind and said, okay, we can help you out. We'll give you a discount. And I'm going to try it and see how that goes because I need something to sometimes relax me because I get a little too hyper, and that's not always healthy myself.
And throwing out the C word is always a fun thing. Yeah. You get people to do what you need.
But it's important.
But it is important because these pieces also educate you and make you stronger.
Right, definitely. And you feel more empowered. And empowerment, I think, is so cool. Like I took the course of plant-based nutrition with Colin Campbell, and that was online. And, I never took a course online before. And at first I was freaking out. I'm like, oh, am I going to do this? And I was able to do it. It felt so good. And I learned a lot.
And that's the beauty of it. There are so many courses online that you can take.
Yeah.
A lot of them are free. I just adore the New York City Open Center. Mm-hmm. They have so many different courses. Right now, everything that they do is online. They're reasonably priced. And they have, by the way, free sound therapy during the day, every day. They do meditation on Mondays and, or during the week on certain times. So these are all things that you can hook up into and be able to see what works best for you. Kind of going back to that analogy of the shoes. Does it fit? Yes, no, maybe. Get whichever one you want, and realizing that some things help at some times, and that's okay. Use it for that specific time when it helps you, and then move on to the next. So,
that's true.
It is getting what you need, how you need it. And if you don't know how you need it, well, isn't it wonderful to explore?
True. That's true. Because this is a journey. Actually, everything changes. Every year changes when you've had cancers. What you were last year, you're totally different this year. Maybe you were weaker last year, and this year you're stronger. Your mindset is different every year. So I think it's a journey, but it's okay. Sometimes we need to have that journey, and push us to change. Because if we were in the mindset of, oh, gee, I'm a victim, woe is me, and you've always thought that way, you have to change that mindset or you're not going to make it. And I think that's great because this way you have more of a positive attitude. So
and I look at it from the perspective of, how do you want to live life? Do you want to always be pissed off? Do you want to just feel so unempowered? Or do you want to build your strength and move forward and find ways to do that? One of the things that we had in our household was that every 3 months you had to learn something new. Doesn't mean you have to keep it.
Right.
You don't have to become an expert, master it, but you had to try it, learn something new. And that allowed you to be able to see different glimpses, different possibilities, different connections, because we make different connections. Something as simple as, joining audibles. I love audibles. And, because you can be walking and audibles is just reading the book to you. And finding, which is so important, don't sit there and read books that are depressing. Read books that are going to empower you. Find ways to empower yourself, because that's up to you. You can lead a horse to water, but you can't make them drink. So nothing that we say about empowering yourself and thinking better and doing better and exercising or doing yoga or whatever, none of that works unless you allow it to work. Because you can sit there and be miserable, or you can sit there and start changing. And that's the one thing I have to say that I love about COVID. Believe it or not, I really love the fact that COVID gave you this opportunity to look within.
Right.
Because you had to learn how to be your own entertainment center.
Yeah, especially people that live alone, right? Yeah.
And we did that when we were kids, didn't we?
Yeah.
We found ways to entertain ourselves.
Definitely.
Now, everything is, it's like, oh, you need to entertain me. Well, that's not the way life is. Find things that make you happy. It's up to you, not anybody else. And we can give you a whole bunch of examples, but it's always up to you to do that. So, believe it or not, we're at the end of our show again. Woo! This is so awesome. All the things that we do. Thank you so much for those of you that requested we do this show for you. You're always welcome to send us information. If you have questions, if you have an idea for a show, if you want to be on our show, please know that we don't hate doctors. We love them. We love the appropriate ones. So thank you so much for watching. Feel free to contact us at info@cancertamer.org. And thanks for watching.
Thank you.